In a situation where you can't intubate or ventilate a patient, you need to perform a cricothyrotomy. But if we're talking about a pediatric patient, the equipment used for a cricothyrotomy is going to be different due to the accessibility of the cricothyroid membrane. Okay, so here's an adult's trachea. You can see the thyroid and cricoid cartilage are far apart, and there's more than enough space to pass a good-sized tube through. Typically, you're using a 6-0 endotracheal tube, which is 6 millimeters in diameter, or a 6-size tracheostomy tube. In this case, you'd be able to pass the tube directly through the space, so you'd make an incision to pass the tube, which is called an open cricothyrotomy. But here in a child, you can see the space is much smaller, and you can barely see the cricothyroid membrane. There's only enough space for a small catheter to be passed through without damaging the cartilages. So for a pediatric patient, we'll be passing an IV catheter over a needle, which is why it's called a needle cricothyrotomy, or needle cric for short. We're going to use a 14-gauge catheter, which is much smaller than the smallest ET tube, but it's big as far as IVs go, so it still has just a little bit of space to oxygenate and ventilate temporarily. The age at which you can do an open cricothyrotomy in kids is debated, and it depends on the patient. It's somewhere between 8 and 12 years old. That's when the space might be big enough to pass an actual tube, and you wouldn't have to settle for the catheter. The most conservative approach is to use age 12 as your cutoff, but most sources agree that under age 8, you should really be doing a needle cricothyrotomy as your surgical airway of choice. If you're unsure, you can always palpate the external anatomy to see if it feels like there's enough space, or you can perform a needle cricothyrotomy. Now, let's talk about setup. The first thing you need to do is grab a resuscitation bag, antiseptic solution, and a 14-gauge IV catheter. Our goal is to attach this resuscitation bag to the 14-gauge catheter. And you have two options to do that. You can either use a 7-0 or a 3-0 ET tube adapter. The adapter is this hard piece of plastic at the top of the tube. So you'll just pull that off of the tube like this. The option you choose really just depends on your preference and what you have available to you. The 7-0 is much more common in the ED than the 3-0, so you might just want to remember the 7-0 setup. With this setup, you will need to grab a 3 ml syringe because the 7-0 adapter doesn't attach directly to the catheter. If you go with the 3-0 ET tube adapter, then you can directly attach it to the 14-gauge catheter. Now that you're familiar with the setup, let's practice on an infant. First, I'll palpate to find the cricothyroid membrane. One thing that's important to know is that the thyroid cartilage is less prominent in children. In an adult, I'd palpate down from the thyroid cartilage, but in a child, it might help to palpate up from the sternal notch and over the cricoid cartilage until I find the right location. I'm feeling for a dip between the thyroid and cricoid cartilages. Now that I've located the cricothyroid membrane, I'll prepare the neck with antiseptic solution. Next, I'll attach a 14-gauge catheter over a needle to the syringe and place it at about 30 to 45 degrees, aiming towards the feet, and I'll aspirate as I advance. Once I aspirate air, I know I'm in the trachea. Then I'll connect the catheter to my chosen setup, aka the 3-0 ET tube adapter directly to the catheter, or the 7-0 and the 3 ml syringe to the catheter, and finally attaching to the resuscitation bag. Now that I've bought myself some time, I can take a deep breath and figure out how to get a more definitive airway.